Hello, my name is Dr. Calynn Lawrence, and I am the founder of the Holistic Healing Source for Marginalized Society. I'm a board certified forensic traumatologist and a doctorally prepared pastoral counselor. Let's go ahead and get into this lesson. Thank you so much for joining us. I'll go ahead and share my screen. The need for whole person recovery, healing the mind, body, and spirit. This is a topic very near and dear to me as somebody who has been on a journey personally for whole person recovery. And I look forward to getting into the details with you. Let's jump right in. Holistic care is fundamentally defined as an approach that integrates the physical, psychological, social, and spiritual dimensions of an individual's overall well being. Across multiple medical disciplines, healthcare professionals are increasingly recognizing that true rehabilitation requires more than simply stabilizing acute medical conditions with a focus on the physical. For example, personalized approaches to intensive care unit distress advocate for a paradigm shift that moves beyond mere patient survival, aiming instead toward comprehensive holistic recovery. However, a truly effective whole person recovery model must recognize that health is deeply intertwined with social, cultural, and systemic realities. For marginalized populations, including women, BIPOC or Black, Indigenous, and people of color, individuals with disabilities, and the LGBTQ plus community, a holistic approach is not just a beneficial addition, it is an absolute necessity for achieving health equity. When healthcare systems focus entirely on symptom management, they often require or they often um, miss the intricate, interconnected factors that drive long term health, while simultaneously ignoring the systemic biases and compounded stressors that marginalized populations face daily. There is an urgent and undeniable need for whole person recovery models that comprehensively heal the mind, the body, and the spirit for all patients. The shortcomings of fragmented care and multimorbidity. Contemporary healthcare systems frequently struggle to adequately manage patients facing multimorbidity. Because patients live with multiple chronic conditions, typically require comprehensive care that extends far beyond disease specific pathways, traditional models are often insufficient. The effectiveness of conventional clinical models can be severely limited by treatment burdens, polypharmacy, fragmented healthcare services, and poor continuity of care. Marginalized groups frequently bear the brunt of these fragmented systems, which often fail to account for the complex social determinants of health and gaps in care continuity. To overcome these structural hurdles and historical barriers, general medicine acts as a vital clinical bridge. General medicine holds the potential to translate highly fragmented multimorbidity care into coordinated, system aware, and whole person clinical practice. Primary care interventions commonly utilize individualized care plans, extended consultations, medication reviews, relational continuity, self management support, cross sector coordination, and robust interdisciplinary collaboration. A similar systemic fragmentation is often seen in the treatment of substance use disorders. Substance use disorders are incredibly complex conditions characterized by the problematic use of psychoactive substances, such as alcohol and drugs, with significantly significant ability to impair an individual's daily functioning. Historically, the treatment for substance use disorders has been compartmentalized into entirely separate medical, psychological, and spiritual domains. However, recent clinical research strongly advocates for integrated treatment approaches that combine these various methodologies to support a deeply holistic recovery process. Healing the body, medical care, function, and autonomy. Physical rehabilitation and medical stabilization represent the vital first steps in any recovery journey, but they must be administered through a holistic, equitable lens. In the context of substance use disorders, medical treatments primarily target the physiological components of addiction, specifically managing dependency and acute withdrawal symptoms through detoxification and medication assisted treatment. Despite their necessity, purely medical approaches cannot resolve the underlying environmental, social, and psychological factors that precipitate substance use and eventual relapse. Looking at broader primary care, physical recovery relies heavily on maintaining an individual's functional status. For older adults and individuals living with disabilities, the ability to perform basic and instrumental activities of daily living is intimately tied to their independence and overall quality of life. When these individuals experience functional decline, they are at a much higher risk for adverse outcomes, including hospitalizations and institutionalization. Consequently, maintaining function is one of the health outcomes that matters most to these populations. Losing independence is a prospect that many fear far more than financial hardship or death itself. Furthermore, women and BIPOC individuals who were intentionally included in diverse clinical sampling to better understand patient perspectives on holistic care often navigate medical environments where the pain, symptoms, or unique cultural needs to them are historically minimized. To explore patient perspectives on physical functioning and care, a qualitative study involving semi structured interviews was conducted with 28 patients aged 65 or older and 5 caregivers from Veterans Affairs primary care clinics. The study revealed crucial insights. Most participants explicitly reported that measuring function is an inherent part of holistic quality care. Participants noted that interdisciplinary approaches to measuring functional status are optimal. Patients generally prefer face to face assessments, viewing them as the most intimate method that actively prompts reflection on one's physical limitations. When clinicians communicate about function, patients noted that asking about a patient's difficulty with activities versus asking if they need help are two distinct complementary concepts. Furthermore, participants emphasize that providing clear context is absolutely essential when discussing highly sensitive topics, such as a patient's functional decline, to protect their dignity and autonomy. Healing the mind, psychological therapies, and cognitive growth. Once the physical foundations of recovery are stabilized, holistic care must rigorously address the mind. Psychological interventions are a vital cornerstone of whole person recovery, especially in mitigating mental or behavioral health conditions and substance use disorders. For decades, cognitive behavioral therapy, or CBT, has proven to be highly effective in altering the dysfunctional thinking patterns and destructive behaviors that actively contribute to substance abuse. CBT works by helping individuals accurately recognize and challenge their negative thought patterns, allowing them to change behaviors that trigger substance use and ultimately develop much healthier coping mechanisms. However, when applying these psychological frameworks, a whole person must approach or a whole person approach rather, must recognize that negative thought patterns do not exist in a vacuum. For marginalized communities, including women, BIPOC individuals, disabled persons, and the LGBTQ plus community, psychological stressors are frequently magnified by systemic inequities and social discrimination. For instance, the psychological burden on sexual and gender minority groups is often exacerbated by non inclusive healthcare policies and a historical lack of systemic support. Therefore, if psychological therapies are to be truly effective, they must be delivered by a culturally competent workforce trained to understand the specific nuanced needs of SGM individuals and other marginalized patients. Mental health interventions cannot simply treat the symptoms of distress. They must actively acknowledge the heavy toll that systemic bias and fragmented healthcare services take on a patient's cognitive well being. To address these complex mental landscapes, additional psychological interventions, such as motivational interviewing and relapse prevention therapy, are heavily utilized. These specialized therapies are designed to significantly enhance a patient's motivation while helping them develop strategic tools to cope with or avoid specific situations that could lead to regression. For aging populations or those living with functional impairments, psychological and emotional support is just as crucial. General medicine models that utilize extended consultations, relational continuity, and self management support have been shown to provide more consistent emotional support than fragmented, disease specific models. Through these specialized mental frameworks and interdisciplinary collaborations, individuals learn to actively reshape their cognitive responses to stress, paving the way for long term behavioral change. By combining evidence based psychological therapies with culturally competent, system aware care, providers can offer mental healing that deeply respects the very backgrounds, identities, and lived experiences of every patient. Healing the spirit, community, meaningfulness, and redemption. The third, often overlooked pillar of whole person recovery is the spirit. Spirituality is broadly defined as the various practices and deeply held beliefs that foster a connection to something greater than oneself. Integrating spirituality into treatment plays a highly transformative role, directly addressing the deep seated human needs for meaning, connection, and transcendence that conventional medical therapies often neglect. Spiritual practices, which include participation in spiritually integrated therapy groups, meditation, and prayer, provide a crucial support system that offers individuals a profound sense of belonging, newfound purpose, and hope. Extensive research highlights that spirituality is closely associated with significantly reduced rates of relapse, and it can actively enhance a patient's resilience. In the realm of addiction recovery, the concept of redemption involves a deeply transformative process where individuals successfully overcome their intense struggles with substance use and emerge with a renewed sense of purpose and self, successfully reconciling with their past to build a hopeful future. A major facilitator of this spiritual and social recovery is the utilization of recovery community centers. Recovery community centers are vital institutions that offer support services specifically for people in recovery, including recovery coaching, employment support, mutual help meetings, and sober social activities. To measure the holistic impact of these centers, a daily diary study was conducted involving 88 RCC attendees in Pennsylvania over 10 consecutive days. The findings strongly validate the holistic value of community support. Participants generally reported that their specific visits to the RCC were helpful, recording an average score of 87.13 on a 100 scale. Nearly half of the statistical variation in RCC helpfulness was directly attributable to intra individual variation. Multi-level models from the study revealed that both intra-individual and inter-individual RCC experiences successfully predicted an increase in holistic recovery outcomes compared to the prior day. An individual's mean level of perceived RCC helpfulness positively predicted the holistic recovery indices of daily meaningfulness and recovery identity. Fostering inclusivity, culturally competent holistic care. A whole person approach to recovery cannot be truly holistic if it ignores the unique social and cultural realities of diverse patient populations. This disparity is distinctly visible within the LGBTQ community. Sexual and gender minority groups experience severe healthcare disparities, which are largely driven by non inclusive healthcare policies and a lack of systemic support. To combat these inequities and guarantee the provision of culturally competent care, it is mandatory that nurses and other health staff receive specialized training focused on addressing the specific needs of sexual and gender minority individuals. A recent scoping review systematically synthesized evidence regarding the training nurses receive to deliver holistic care to sexual and gender minority populations across 4 electronic health databases. The review evaluated articles published between 2021 and 2025 using the population, concept, and context framework, identifying 3 key themes: the explicitly beneficial outcomes of specific healthcare training for nurses on SGM issues, the various factors actively hindering nurses from successfully providing holistic care to SGM groups, the specific characteristics of the content currently taught in nursing education. The review ultimately concluded that training programs aimed at effectively equipping nurses to deliver holistic care to SGM individuals desperately require improvements in both their delivery methods and their overall duration. Furthermore, it is imperative for higher education institutions to rigorously prioritize the provision of training on SGM issues for all healthcare educators to substantially improve curriculum development across the board. Broad collaboration among healthcare stakeholders can dramatically enhance healthcare outcomes for SGM groups, develop a highly culturally competent workforce, and help inform policies to ensure marginalized patients feel seen and respected in clinical environments. In conclusion, the pursuit of optimal health must transcend the traditional boundaries of symptom management and acute crisis stabilization. To foster genuine, sustainable rehabilitation, healthcare providers must embrace an integrated framework that heals the body through strong medical and functional foundations, fortifies the mind through cognitive and behavioral therapies, and nourishes the spirit through community connection and meaning making. Ultimately, whole person recovery is a matter of social justice. Healing the mind, body, and spirit requires dismantling non inclusive policies, addressing functional and physical vulnerabilities with empathy, and ensuring that every patient, regardless of their race, gender, sexual orientation, or physical ability, receives comprehensive, culturally competent care. And here are the references. Thank you for listening.